Here we will examine the scapula and the structures of the scapula from the lab list. So as you can see, the scapula is roughly triangular in shape, with the medial border being here, which is also called the vertebral border, because this border is in closest proximity to the vertebral column. The lateral border is on the opposite side here, where my left hand is holding it, and the lateral border is also called the axillary border because of its proximity to the arm. So this is the posterior side of the scapula, and you can always tell the posterior side because it has this ridge of bone tissue here that's called the spine of the scapula. And the spine of the scapula that transitions into this blunted end over here that's called the acromion process. Now the acromion process here is where the clavicle articulates with, so that's the clavicle attachment point to the scapula. Also towards the lateral side here, if I kind of turn it, we see this little depression here in the lateral side of the scapula, and that's called the glenoid fossa. And the glenoid fossa is where the humerus articulates with. So we've got two bones that connect to the scapula. We've got the clavicle, which articulates with the scapula right here, and the humerus, which articulates with the scapula at the glenoid fossa. So flipping it over and looking at the anterior side of it, we can see that the anterior side is smooth and nearly flat because this is where the scapula rests against the rib cage. There's a small projection here that comes off of the anterior and superior part of the glenoid fossa, and this little projection right here is called the coracoid process. This is a muscle attachment point. It's actually where one of the divisions of the biceps brachii muscle, which is the large muscle that's on the anterior part of the arm, articulates with. So an easy way to tell right from left in terms of the scapula, whether you have a right scapula or a left scapula, is to make sure you're looking at the posterior side. So we'll go ahead and flip it back over here. Once you find the posterior side, simply see which direction the glenoid fossa right here is pointing towards. If it points to the left, then it's a left scapula, but if that glenoid fossa points to the right, then that's a right scapula.